It's often referred to as the other public health emergency. Many feel the opioid crisis has taken a back seat to the COVID-19 pandemic, even as new statistics show overdoses are a much deadlier dilemma. The numbers are numbing. In October, 162 people died of illicit drug overdoses in the province, according to the BC Coroners Service.
Over 5 people a day for all this time?
Since the pandemic began, an extremely toxic drug supply has caused more than 100 fatal overdoses a month, 1,386 lives lost, 4 times the number of COVID-related deaths.
Don't use alone. Let somebody know. Talk to somebody. Use the app. Have your drugs checked. Reach out.
We have failed. The province has. Successive governments have to take it as seriously at every level.
Karen Ward is a drug user and policy advisor with the City of Vancouver. She knows there's no silver bullet.
Poverty, the health system, policing, housing, all these different things, the way that we organize our cities. This isn't a simple disaster, right? It's a complicated mess.
A complicated mess that requires money. The province promised $10.5 million in overdose response funding back in August, but Ward says the cash still hasn't found its way to the front lines.
What is going on here? Who's in charge?
Meanwhile, Vancouver Mayor Kennedy Stewart hopes the city can be the first in Canada to decriminalize possession of illicit drugs for personal use, to erase stigma and encourage access to support. Still, as vaccine development spurs hope in the fight against COVID, the prognosis for the opioid crisis is grim.
The light at the end of the tunnel is the train, and it's going to hit us. So, it's going to get worse.
In Vancouver, Travis Prasad, City News.